Thank you. Yes. Very good. And your name is?
Stuart.
Stuart, yes,
Yeah.
we've met. I remember your necklace. All right, Stuart. And, okay, tell me what's going on. Tell me what you would like to have treated.
So I stopped breathing when I think of my accident because I have PTSD.
Okay.
And
All right.
I almost lost my life about 8 years ago, and I actually had to save my own life by controlling the blood flow and so forth. So, yeah,
You're a survivor.
I'm not breathing right now. So.
Okay,
Yeah.
okay, no, not very good, but yeah, we're there. That's all we need. We don't need to go any deeper with that. I obviously don't have to push that one. Very good. What is your number? Is that a 10?
Oh, yeah.
Oh, yeah. Okay, very good. Let's get going. Everybody tap along, side of hand.
I tap hard.
Just enough to give some energy, not enough to hurt. 15 taps is usually all that's needed for that point. Everything else, 5 to 7 taps is plenty. Very good. Thinking about that trauma, eyebrow. Just where it begins, a little closer to your nose, further down. Excellent. Under your eye, on the bone close to the nose, under the arm, and collarbone. When you think back to this, is there anger, rage, resentment?
Fear.
Just fear.
Fear of death.
Okay. Fear of death. Okay, good. Eyebrow, eye, just eye, and arm, and collarbone. So what I'm hearing now is that we're focusing on the fear of death, because there may be multiple issues with that, you know, with this part of the accident, that part of the accident, this part. Is that okay if we focus on the fear of death?
Yeah.
Okay, very good. Is there guilt, shame, or embarrassment with fear of death? No, and I'm asking that not to imply that he should feel that way, but it tells me what points we need to activate. Is there depression when you think about fear of death? Yeah, okay. Go into the gamut spot on the back of the hand right here. Very good. And that point loves a lot of attention, so we're going to linger there. Your thyroid point. And collarbone. Very good. Okay, we're going to go back to eyebrow and collarbone and eye and collarbone. And where are you at on this?
Probably about an 8.
An 8, okay, so nice drop. Let's do a 9 gamut treatment. Close your eyes, open your eyes, look down to one side on the floor, down the other side of the floor. Whirl your eyes in a big circle. Whirl them in the other direction. Rest your eyes now and hum. 1, 2, 3, 4, 5. Thinking about this issue of fear of death, eyebrow, under the eye, under the arm, and collarbone. Good. I'm going to expand the treatment here a little bit because it's not uncommon, particularly because this is a first treatment. We haven't addressed any of the other layers. If they were to leach in a little bit and affect that particular focus that we have now. So tiny finger. That is your heart, associated with the organ heart. And collarbone. We're going to go to middle finger, very tip of the middle finger, just on the side of the nail. And yes, that one is used exactly what you think it's used for. We'll need to cut that out of the movie. Index finger. And collarbone. And thumb. Collarbone. Chin. Lowest part of your chin, right in the groove further up, yeah, just under your lip. Very good. Lowest part there. Little further up yet. Very good. Under the nose. And gamut spot. This is the depression treatment. That treatment is also, the same treatment is also used for physical pain. So if you're experiencing any discomfort in your body, just focus on that and do this treatment point about 50 times. And collarbone. Very good. And under the eye again. And collarbone, eyebrow, eye, arm, and collarbone. All right, going to take a break here, check in with you. Fear of death, that's what we're focusing on. I know there are more layers, there are more aspects, but that's the focus we have right now. How intense is that?
It's probably about a 5 right now, but
A 5.
I'm just breathing.
Sorry?
I'm breathing now.
You're breathing, okay, so these are good changes.
Yeah.
You will see changes in complexion. I've had people who took literally 10 years off their face after a treatment. It can be that profound.
Yeah.
It's visible. Is it okay with you if we do another round?
Oh, yeah.
Okay, very
Yeah,
good.
we'll do
So we've already cut it in half from a 10 to a 5. Let's see if we can take this even lower. I would like you to take your right hand, put it on your upper left chest. You can do it right through your clothes, whatever is convenient and comfortable for you. Thank you for being so brave, and thank you for looking out for yourself and doing this work. I believe when we just change one little issue, the entire planet is a different place. There's not an atom that could still be the same, even if we just change one little thing, one little person somewhere. It affects everything, the whole web. Very good. Tap under the nose. And index finger, very tip of index. And side of hand. So in case the microphone wasn't able to pick it up, we're treating the trauma of a car accident that almost cost a life. And eyebrow. Very nice.
It was actually a chainsaw accident.
Oh, sorry, I just assumed car,
Yeah.
chainsaw.
Yeah.
Okay. And under the eye, you still have all your limbs?
Yeah.
Yeah.
Yeah, I almost lost my right hand.
Okay. Wow. And under the arm. Fear of death is what we're working with here. And collarbone. Tiny finger. That's your anger point. Anger goes to the heart, literally, energetically at least. Collarbone. Let's do outside of eye. And collarbone. Middle finger. Collarbone. Index finger. Very, very tip, just on the side of the nail. Very good. And collarbone. And chin right in the groove, under the lip, under the nose. I'm really throwing a lot at this now. This is basically almost all the tapping sequences we have in thought field therapy. We may be overkilling, pardon the pun, a little bit here. But I just don't want to leave you high and dry and then, okay, let's do another round and another round. Let's reduce this pain as quickly as possible. Again, that's treatment here is for depression and physical pain. We take that to collarbone. We're going to do a 9-gamut sequence on this and see where that takes us. And close your eyes, open your eyes, look down one side, down the other. Whirl your eyes in one direction, whirl them in the other direction. Rest your eyes and hum. 1, 2, 3, 4, 5. And eyebrow. Fear of death. Under the eye. Under the arm, collarbone, tiny finger, collarbone, middle finger, collarbone. And you see I can go fairly quickly through these points, index finger and collarbone. We're dealing with fear of death, outside of eye, and collarbone, thumb, Very, very tip just on the side of the nail, collarbone. That's your lung point, by the way. When I hear I can't breathe, let's go to lung point. And chin, under the nose, and gamut spot for depression. On the scale of phobias, fear of death is about number 9. So it's fairly common. And I've worked with clients who had pages and pages and pages attached to their will and testament to give his relatives a very exhaustive protocol so they can absolutely make sure that he is dead. So I'm not, I'm not feeling all cuddly and comfortable about the thought of being alive in a coffin, buried 6 feet under, but it's not something that preoccupies my mind. It's not something I lose sleep over. I just say, if it happens, I'll deal with it then. But for him, it took up every minute of his conscious being. And being able to create more room there and just put that to rest, no pun intended again, can be very, very useful. And collarbone. We're going to go back to eyebrow, collarbone, and under the eye, collarbone, arm, eye, and collarbone. That's a very long tapping sequence, obviously. Let's take a break here. Fear of death, what's your number?
It's pretty good. I would say probably 2.
A 2?
Yeah.
Nice.
1, 2.
Let's 1 or 2. Let's see what a floor-to-ceiling eye roll can do with that. Tapping the gamut spot on the back of the hand again. Your head is nicely balanced. Your eyes go all the way down to the floor. Roll them across the floor, slowly and smoothly up the wall, all the way up to the ceiling. And when you're at the very top, you're done. Okay. How does that feel?
It's good. It's good. There's underlying, you can feel it. There's more, right?
Yes.
But
Pick me, yes. And obviously, so we have completed this treatment, but we're not done, okay? And so what I invite you to do is consider having a rapid response, rapid release session with me,
right.
And we can get to these more layers. What I'm showing you today is spot cleaning. We're not doing the whole house, okay? That's where I love spending, 4, 6, 12 months with someone, and we do a complete soul makeover. This is spot cleaning, but it can nonetheless be very, very powerful and life-changing. Thank you.
Okay, Brenna, thank you.
Thank you. Beautiful work.